So chapter 20, it's about lymphatic system and immunity. And the lymphatic system is made by a group of organs, primary organs and secondary organs, and tissues that together work for having a strong immune system to help defend our body against infections and against diseases like cancer. So we have some microorganisms that can cause disease that are called pathogens. And when we encounter them, our immune system reacts by producing antibodies or preventing these pathogens from entering into our body with enzymes and with proteins. Now we have in this system a fluid that it is the lymph that is carried from the excess of interstitial fluid that it was given by the capillaries to our cells. And then that fluid is carried in a system of blind-ended vessels that we call lymphatic vessels. They are similar to the capillaries in terms that they have only one layer of cells, so they only have tunica intima. And these lymphatic vessels, they extend their tunica intima to form valves that helps to bring the lymph from lower regions of the body to the circulatory system. And then for lymphatic tissue, we have examples of clusters of this lymphatic tissue within the lymphoid organs or lymphatic tissue itself that we call the lymphoid follicles. Examples of these will be located in the tonsils, Peyer's patches, the lymph nodes, the spleen, and the thymus. So here is an overview of the lymphatic system. So this is the anterior view. All of these vessels that you see in green color represent the lymphatic vessels. And then these little dots that you see in a specific regions, like in the axillary area, inguinal area, in the antebrachial area. So these are what we call the lymph nodes. And then in young children, you will have above the heart this organ that is called the thymus. In the thymus, we have training of cells for the lymphatic system. And once you reach adult stage, in terms of your immune system, you don't need the thymus anymore. So this organ regresses. Tonsils, we have it in the oral cavity, protecting ourselves from infections from the oral cavity. Also, we have it in the nasal cavity, in the nasopharynx. This would be called the adenoids, protect us from infections coming from the respiratory system. And then we have another organ, like the spleen, that helps to trap bacteria. And then we have the appendix, that apparently it helps to train lymphocytes. And in certain areas of our body, like in the ileum, which is the last part of the small intestine, we have tissues like Peyer's patches that help us prevent infections from the digestive system. So, one of the major functions of the lymphatic system is to regulate the body fluid. So, the fluid in our bodies, it has to be in a specific amounts outside the cells and within the circulatory system. In order to prevent excess of accumulation of fluid in the circulatory system, we have the lymphatic system with the lymphatic vessels or lymphatics that helps to pick up excess of fluid that was released by the capillaries. So the interstitial fluid, it is released into this interstitial space by the capillaries in an amount of between 2 to 4 liters per day. So that's a lot of amount, but 90% of this fluid has to return into the circulation so that we don't end up puffy, edematose. So once this interstitial fluid then enters into the lymphatic vessels, you will call this fluid a lymph. Now, we also have another function of the lymphatic system, which is pick up nutrients. Inside our enterocytes, which are the cells that are located in the small intestine, we have villi, finger-like projections, that inside they have lacteals. So these are lymphatic vessels that specifically absorbs nutrients like fats or lipids that we have in our diet. So it helps then to absorb dietary fats and to bring it into the circulation. And then another function of the lymphatic system, it is to protect us from pathogens by filtrating these pathogens from the lymph and from the blood. So we have a specific name for the lymphatic vessels. If they are large, like if the lymphatics merge, they would form these trunks. So lymph trunks receives lymph from specific parts of our body. Lumbar trunks are located inside our abdominal cavity in the lumbar area. They pick up the lymph from the lower limbs and the pelvic area. Intestinal trunks, they receive the lymph from the small intestines. This lymph is going to be rich in lipids. Jugular trunks, we have it here in the neck, next to the jugular vein, and they receive the lymph from the head and neck. And then bronchomediastinal, broncho for the bronchi that we have, the airways that we have inside our lungs. Mediastinal for the mediastinum. So these one pick up the lymph from the thoracic cavity. And then subclavian, they're located under the clavicles. They pick up the lymph from the upper limbs. So the intestine and the lumbar trunks drain into a large swollen vessel that is called the cisterna chyli. It's posterior, it's located posteriorly in the abdominal cavity, almost at the level of the umbilical cord, or well, the navel area. So the cisterna chyli, then it will continue above this area and go up, and it will form something that is called the thoracic duct. The thoracic duct, it will drain the lymph into the left internal jugular, into the region where the left internal jugular merge with the left subclavian vein. The right lymphatic duct drains the lymph from the right upper side of our body, including the right hemithorax, the right upper limb, the right side of our face, the right side of our brain. And it drains at the region where the internal jugular merges with the right subclavian, the right subclavian with the right internal jugular. So here is the view of the main lymphatic trunks and ducts. So here we have left lumbar, and then here we have the right lumbar trunks. Together, these two with the intestinal trunk here in the middle drains into the cisterna chyli. And then the cisterna chyli continues above as the thoracic duct. And the thoracic duct is going to drain here in this area, in the left subclavian. So here it is, at the region where the left internal jugular vein connects with the left subclavian. And then what else drains into this thoracic duct? Well, it drains the left subclavian trunk for the left arm, and then the left jugular trunk that drains the left side of our head, all the lymph. Now, in the right thoracic duct, the right lymphatic duct, we have the receiving of all the lymph from this part of the body. So looking here, this is like the entire body. So all of this orange area, like from the right arm, the right hemithorax, the right side of the face, and the head, it is drained by the right lymphatic duct, which drains into the right subclavian in here. So this thoracic duct then drains more lymph than the right lymphatic duct. So for these lymphatic vessels, so we don't have a pump that drives the lymph, so it's a low pressure circuit. But what drives the lymph into the heart? Well, we have the lymphatic valves that prevents backflow, and then we have the muscles that contract these trunks, and then we have also the smooth muscle in the walls of the lymphatic collecting vessels, the larger ones, plus a negative negative force that we have in the thoracic area every time that we inhale, that causes the lymph to return into the circulatory system. Accumulation of excess of lymph is called edema, and lymphedema specifically refers to severe and disfiguring accumulation of fluid. Generally, this can be done because someone may have removal of some lymph nodes and lymphatic vessels during a surgery. For instance, removal of part of the breast, mastectomy, can lead to this. Swollenness of whatever arm or whatever arm side is affected. And then some microorganisms, some parasites can occlude these lymphatic vessels. And then you can have accumulation of fluids. So here we have lymphedema in a person with breast cancer. So for the lacteals are specifically located inside these these enterocytes, and then they receive again this lipid-rich fluid that is going to be called chyle, and then this one is going to empty into the circulatory system. And one way to know, for instance, if someone actually had fast before having a test, a blood test, is like the plasma. It's supposed to be clear in color, but if the person ingested a meal that is rich in lipids, this plasma, instead of looking yellowish clear color, is going to look like whitish, because you have these chylomicrons, these lipids in this plasma. So here is the structure and function of the lymphatic vessels. So here we have your arterial, your venual, your capillary beds, and then in between you have these lymphatic vessels, lymphatic capillaries. So as the interstitial fluid is released in between these cells, these lymphatic vessels open their walls. So see the wall, this is like this is a longitudinal section. So this is the ending of this capillary. Let's say it's this part. So they have only one layer of cells, simple squamous epithelium. And then you have this lymph coming in between the gap between these cells. And another thing that we do as we pick up this lymph, this tissue fluid, we will also pick up anything that it is there, including bacteria or cells. Like see here how the macrophage is entering into this lymphatic. Many cancers metastasize by lymphatic spread. If someone has cancer cells in between these cells, these cancer cells can enter into the lymphatics and go somewhere else in the body. Now for reticular tissue. So reticular tissue, it is found in different organs, including the lymph nodes, the spleen, and in here in this reticular tissue we have collagen fibers that forms a net by orienting randomly together with elastic fibers. And this net, it is important to trap pathogens and specialized cells. So it's an interwoven series of fibers that helps to trap pathogen and also specialized cells like lymphocytes, which can be B and T lymphocytes. It can be macrophages, dendritic cells that are like cells, leukocytes with extensions of the cytoplasm that it looks like a spine. And this is how this tissue looks like. So if you take a sample of one lymph node, this is how the reticular tissue looks like. These are the collagen fibers, elastic fibers, randomly oriented, and forms a net to trap these dendritic cells, these reticular cells, macrophages, lymphocytes. So it's not lymph. They are not lymph nodes are not empty organs. They have all these net of fibers. Now, mucosa-associated lymphoid tissue, also known as MALT, it is loosely organized clusters of lymphoid tissue. And it is associated with mucosas within the gastrointestinal system, respiratory system, genitourinary system. And within specific areas, we have specific names for these tissues. For instance, in the ileum, the mucosa-associated lymphatic tissue is known as Peyer's patches. And then within this MALT, we have lymphoid follicles, which are a collection of B lymphocytes. And these B lymphocytes can be active or not, depending. Like if a person has an infection, they will be active so that the lymphocytes replicate, and they look different than when they are inactive. And then they have also T cells, but primarily B cells, B lymphocytes instead of T lymphocytes. So another area where we have this MALT is the tonsils and the appendix in the large intestine. Now, in the nasopharynx, we have this pharyngeal tonsil that is called the adenoid. Sometimes allergic reactions with the antigens make these adenoids to enlarge. And this enlargement narrows down the nasopharynx, the passage that allows us to inhale air through our nose. And the person will have apnea. And you can see because the person will have dark circles. And not only that, the person is going to have also nasal voice. And these adenoids are really easy to remove when they are enlarged, and then the person will feel a world of a difference because he can breathe better, can sleep better, and the tone of the voice, of course, improves as well. So another tissue, lymphoid tissue, that is small is the palatine tonsils. They're located on the sides of the opening of the oral cavity posteriorly, which is the fauces. These are the ones that you can see when you open wide your mouth in a mirror. These get easily infected by bacteria, and sometimes these bacteria can lead to pus. So this is like the strep throat that we famously know. And then at the base of our tongue, we have a tonsil. This is called the lingual tonsil. Now, there is a difference between a tissue, lymphoid tissue, and a lymphoid organ. A lymphoid organ has a capsule, while the lymphoid tissue doesn't have a capsule. And the capsule is like a wrapping of collagen fibers that protects the tissue. Now, in some tonsils, you have indentations that we call the tonsillar crypts. And these can trap pathogens like the palatine tonsils, but also it can trap food. Sometimes some people have an large inflamed tonsil, and this is going to lead to inflammation because they have like a piece of food there, a stalk, that can remain for several days, and it needs to be removed. So here's the location of the lymphoid tissue within the oral cavity, around the oral cavity. So here we have on the sides of the fauces, here we have the palatine tonsils, this is the lingual tonsil, and this is the pharyngeal tonsil. Now around the tube that connects the throat to the ears, to the middle ear, the pharyngotympanic tube, we have also pharyngeal tonsils. And all of these tonsils, as a group, they form like a circle. It's called the Baldayer's ring. So it's like the entire tissue, including pharyngeal, lingual, palatine tonsils, and the auditory tube tonsils. So if you magnify one of these tonsils, you can see here this middle part, the medulla, and then here the cortex. Within the cortex, you have these lymphatic follicles, and inside these lymphoid follicles, you have germinal centers. These germinal centers will become active to produce more lymphocytes when you have an infection. And then if you have a gap in the surface like this is called the tonsillar crypt. This crypt is where the pathogens can get trapped, or pieces of food. And these pieces of food can sometimes get calcified with time. Now, in the last part of our small intestine, the ileum, which basically connects to the large intestine, since we have the large intestine nearby and you have a lot of bacteria, it makes sense to have a tissue that prevents us from having bacteria coming into this area. However, we have a valve that is called the ileocecal valve that prevents that. And now, in the cecum, the first part of the large intestine, we have a tiny collection of lymphoid tissue that is called the appendix, vermiform appendix. So sometimes this appendix can be obstructed by pieces of food or by feces, and then this narrow lumen that it has, it will not allow the passage of fluids that are normally produced in the appendix, and the appendix become enlarged and inflamed. This is called appendicitis. Appendicitis is inflammation of the appendix. This can rupture and it can cause inflammation of the peritoneal membranes. The person can die. This is called peritonitis. The appendix we have it in the left side. So pain in the pelvic area in the right side, you have to make sure that it's not appendicitis. So here is where we have some mold in these areas, in the ileum, Peyer's patches. So here is the lymphoid nodules with the germinal centers. And then here we have the appendix. This is the cecum, and this is the ileum. So this is the anterior view of our large intestine. These are the small intestines. Questions? Okay, so details about the lymph nodes. The lymph nodes, they are small organs because they are encased by a membrane, a capsule. They look like pinto bean. They have an indentation in the middle that is called a hilum. And the concave part of this lymph node, it is connected by vessels that we call the afferent or arriving. These afferent or arriving vessels brings lymph into this lymph node so that the lymph can be filtered. And then in the middle, where we have the concave part, the hilum, we have only one efferent vessel. And then we have an artery and veins bringing blood supply and draining that blood supply from the lymph nodes. So function of the lymph nodes will be to filter the lymph, preventing spreading of infectious microorganisms and as well cancer cells. It's not foolproof, otherwise people won't have metastases, but in cancer or spreading of cancer cells. But the hope is that any lymph that arrives into the lymph node is potentially having pathogens and cancer cells. And any lymph that exits the lymph node, hopefully it will be completely free of pathogens and completely free of cancer cells. And we have it in the strategic places. We have it in the axillary area, in the armpit, the axillary lymph nodes. We have it in the neck. We have it in the inguinal region, in the groin. We have it inside our abdominal cavity and also in our thoracic cavity. And in the back of the knee, anterior part of our elbow. And the capsule of these lymph nodes and also from other organs, it is subdivided into tiny segments. This capsule, as it is extending the collagen fibers to separate these organs into segments, it will form what is called the trabecula. So at some point, this one this trabecula helps to prevent also the spreading or to contain better the microorganisms and the cancer cells within a specific region of the lymph node, while the rest will remain doing other functions. So in the medulla, in the central part of the lymph node, like the lymph node has an outer region that is called the cortex and a middle region that is called the medulla. So in the middle region, the medulla, we have mostly T cells in a region that is called the paracortex. And in the cortex, we have B cells. The B cells are found in the lymphoid follicles, in the germinal centers. And then these afferent lymphatic vessels bring lymph, while the efferent exits the lymph. And then we have around these vessels, these cortical sinuses that helps to trap 90% of the pathogens in lymph. And then the medullary sinuses drains the efferent lymphatic vessels at an area called the hilum. So here is an example of lymph node. So if you magnify the regions of, well, the lymph node and you see the regions, so it has an outer coat that is called the capsule. That capsule extends collagen fibers to make compartments. This is called the trabecula. And in between the trabecula, you have the lymphoid follicles that has in the center the germinal centers. So in here, we have B lymphocytes. And then this is the medulla. In this medulla, this is where we have the T lymphocytes in the paracortex. And then we have in this part several efferent blood vessels. So see, we have 1, 2, 3, 4, 5, 6. 6 that are bringing lymph and only one that is efferent. So these are afferent, sorry, we have 6 afferent that brings lymph and only one that is draining the lymph, the efferent. Here in this indentation, which is the hilum, where the artery comes in and the vein comes out. So you have capillaries here. So why do we have many afferent bringing lymph and we only have one efferent exiting the lymph or draining the lymph? Going to go to the Lady Jaja concert that's coming. They open the arena. They open several doors. People going to a concert. The concert is over. They only open out of the 12 doors of the arena. They only open 1 or 2. Why do you think is that instead of having the 12 open? Why many afferents and only one efferent?
There's more fluid going in than coming out.
Mm-hmm. So you have more fluid coming in than coming out, and what is the advantage of that?
More filtered coming out.
Hmm?
Is it more filtered when it comes out? Like,
You have more time to filter. You create a bottleneck, right? So you control the blood, the flow of lymph. Well, they keep the people longer after the concert, and the people keep buying more items like T-shirts and all that. So that's why they close out of the 12 doors, 10. And they keep buying things. So what you expect then is as more lymph is coming in, and of course everything is going to come out eventually, but that leaves you time to find pathogens and cancer cells. Now for the spleen is the largest lymphoid organ in our body. It's located in the left upper quadrant, near to the stomach, anterior lateral to the kidneys, and is protected by ribs 9 through 11. Same as any organ, has a capsule, and this capsule extends collagen fibers to compartmentalize this organ, so it forms trabecula. And then you have two major tissue types in the spleen. You have red pulp and you have white pulp. In the red pulp, we have a lot of erythrocytes. That's why it's called red pulp. That's where we recycle the old erythrocytes. And in the white pulp, we have a lot of lymphocytes. And it looks pale in color. So the white pulp surrounds central arteries, and these central arteries are surrounded by T cells and a core of B cells. So here is the spleen in its location, right upper quadrant, near to the stomach. Sorry, left upper quadrant, not right. And then it has this convex part that faces laterally, while it has this concave part that faces medially. And then we have the splenic artery, branch of the celiac trunk, coming in, and then it's going to give several branches to provide blood supply to these different regions of the spleen. And then you have a splenic vein that is going to drain into the hepatic portal vein. So then if you magnify one of the pieces of these tissues within the spleen, you will be able to see these central arteries from branches from the splenic. So these central arteries are surrounded by white pulp with T cells and B cells, which are the leukocytes. And then you have the veins following the course of these arteries. And then you have the trabecula, which is collagen fibers that separates this tissue into segments. And then we have the red pulp that surrounds this white pulp. So this is the white pulp. It looks like the lymphoid follicles that we saw before in the lymphoid tissue, and this will be the red pulp surrounding these lymphoid nodules. Any questions? Now for the thymus, it is a small encapsulated organ located between the lungs above the heart in the superior mediastinum. It has two lobes, the right and the left, and then it secretes hormones that helps to mature T cells. Both B cells and T cells, B and T lymphocytes, are made in the bone marrow. B lymphocytes stays in the bone marrow to mature. T lymphocytes exits the bone marrow, goes to the training center, which is the thymus, and that's where they mature. Once the T lymphocytes are mature, they go into the circulation. It reaches its maximum size around 12 to 14 years old, and after this point, the the tissue of the thymus is replaced by fat. So by age 65, the production of mature T cells drops dramatically in comparison to an infant. An infant is maturing a lot of his T cells because it hasn't been exposed so much to the different microorganisms and antigens that we have around us. So it's constantly training T lymphocytes an infant. And as you keep living, and then you reach puberty, you mostly have encountered most of the antigens and pathogens that you can possibly encounter. And then there is no more need for training school. And that's when you become a rebel. No. So then once you reach elderly years, the training of these lymphocytes is like 2% what it was the rate of the infants. Now, within this tissue of the thymus, we have a series of structures that are called the thymic lobules or Hassall corpuscles, which are lumps that are seen in the surface that are packed with T cells and also epithelial cells. So here is the location of the thymus above the heart in the mediastinum. And then an adult, instead of having thymus, will have adipose tissue. And you can see the right lobe, the left lobe interconnected, adipose tissue substituting this tissue as the person ages. And then you have the thymic lobules, like the little segments of the lobes. So that's the anatomy of the lymphatic tissue, or sorry, in the lymphatic system. Any questions? Now for the function, the physiology of the immune system. So our immune system as a whole helps us to prevent infections by microorganisms and also by viruses, and help us to prevent diseases like cancer. Now, we can subdivide the immune system into 3 lines of defense against pathogens. First through third line. First line is made by physical barriers, like the skin and the mucosas, like our oral cavity, the vagina, the urethra, the anus. All of the mucosas, including the lining of the respiratory tract, the lining of the digestive system, form a physical barrier. And we have the second line of defense, which is made by cells and proteins. And this second line of defense is called also the innate immunity. So we're born with cells of immunity, like NK cells, that protect us against viral infections, against cancer cells. We're born with proteins that are called complement system. We're born with neutrophils that fight infections, so this is the second line of defense. And then the third line of defense, it is known as adaptive, and it's made by both B and T lymphocytes. It's also known as specific. In innate, no matter what pathogen it is, the response is going to be the same, so it's non-specific. But with the adaptive, once you encounter something that you consider foreign antigen, you would set a specific immune response against that, and the response is going to be always the same. So that's why it's called specific. And it adapts because as many antigens you consider foreign, or as many pathogens you find and has these antigens, you will adapt this response accordingly to fight these molecules. So again, the other name for innate will be nonspecific, and not only includes these neutrophils, the complement system, NK cells, but also antimicrobial proteins that exist in the bloodstream, even in the absence of a stimulus, and as well includes chemicals that are inflammatory molecules, like histamine, leukotrienes. And then this response takes about 12 hours to set after you were exposed to a foreign antigen. Now, the adaptive or specific is also known as acquired, because as soon as a person borns, and if the person doesn't have, of course, an immune system problem, a person starts grabbing objects, putting it into their mouth, touching its skin, eating food, that is going to colonize the person with bacteria that, if it's not pathogenic, you learn to tolerate, and that also helps you to block the entry of pathogens. But this person will maybe be exposed to antigens that he considers foreign, and it can be either your own antigen that sometimes changes its shape, and then the person won't be able to set a strong immune response, or he may set it up depending on how strong is their body. So for adaptive immunity, we have a subdivision, the one that we develop. So we have the cell-mediated immunity and antibody-mediated immunity. Antibody-mediated immunity is also known as humoral. Cell-mediated immunity is given by T cells. Humoral-mediated is given by B cells. And they protect us against different things. Like cell-mediated immunity protect us against intracellular infections and against cancer. Humoral mediated protect us against infections that are found in body fluids, like an infection in the pericardial fluid, an infection in the pleural fluid, in the blood. So humoral comes from the belief from Greek ancient doctors that body fluids were humors. So this adaptive immunity, it takes between 3 to 5 days to set a response after someone was exposed to an antigen. And something about a specific immunity versus innate is that you will develop memory, immunological memory. So you will have then a set of cells that are called memory cells that can respond much quicker to the same antigen. And with innate, you don't have memory. So in a way, once you develop immunological memory, you respond much faster than with the innate. And that's the reason why we have vaccination, and that's the reason why we have boosters within certain vaccinations. Because with these boosters, we already set an immune response previously, and that will make it to be much faster and stronger, creating your memory cells. So here are the details of the barriers from the innate immunity. So the skin. The skin, of course, if you don't have a wound, it covers you and protects you, your entire body. So we have several layers of squamous cells, and then we have keratin. In mucous membranes, we have different types of epithelium. We have columnar cells, we have cuboidal cells, simple columnar, simple cuboidal. And sometimes even can be stratified squamous, like in the case of the vagina or the last part of the anus. So this mucous membrane is not a skin, so it doesn't have keratin, and generally thinner than the skin. So it's more easily for microbes to penetrate through mucous membranes than through the skin. And then in these barriers, we have chemicals that are released that helps for the protection. So that was a physical barrier, but also we have a chemical barrier. So we have oily secretions like sebum that with these fatty acids make an acidic pH. So that will decrease the growth of microorganisms. And then we have in the mucous membranes, we have basically gloved cells that produces mucus that helps to trap these pathogens. And also we have these enzymes that can be secreted like lysozyme that can destroy the bacterial cells, the bacterial wall. And then we have physical extensions like the cilia that helps to sweep away any pathogens. Our stomach, the mucosa of our stomach, secretes hydrochloric acid. Most of our bacteria don't tolerate that low pH, with the exception of the only bacteria that can cause an infection in the stomach. That's Helicobacter pylori. That tolerates acidity in a way because later on it changes this acidity of the stomach into a basic pH that helps it to thrive. And then in our skin we have defensins, which are antimicrobial peptides that can damage as well the cell wall of bacteria. We also have normal flora. Normal flora lands into receptors that we have in the skin that prevents the pathogens from landing into these receptors, preventing invasion. As well, the normal flora secretes regularly acids, which helps to prevent pathogens from growing. So normal flora basically competes with the pathogens for receptors, a niche where to stay, and also for nutrients. Now, unfortunately, certain bacteria can cause infections, especially if you have a wound and you don't take care of the wound. They can penetrate through the wound, and then they can have their own enzymes that they can break down the collagen fibers that we have in the skin, and that makes it to go deeper. So a local infection can become regional infection through these enzymes, like collagenase. An example would be this bacteria that is called Clostridium perfringens. This can destroy collagen in the basement membrane, go to the dermis, and in the dermis can grow and produce gas. And then the person will end up with blisters of gas. So it will have something that's called bullae. And in that wound where these Clostridium perfringens spores penetrated, and then it forms a mature form of bacteria, it's called vegetative, it starts forming this gas. And if you compress one of these bullae, this bubble gas, if you have the opening of the wound that is not obstructed, that gas can go out. And this bacteria, since it's an anaerobe, it can release a gas that is very malodorous. And then as it's growing in there, it can release other enzymes. Now we have some fungi that is resistant to the action of the immune system, like blastomyces. So these are fungal yeast cells that causes a disease that's called blastomycosis. It's an infection of the skin, and because it has very thick walls, the fungal cells are not easily eaten by the phagocytes, like the neutrophils or the macrophages. Other fungi can have a capsule, like Cryptococcus neoformans, Histoplasma capsulatum, and then these can survive inside the macrophages, and they can be spread through the lymphatic system and also through the blood to other places in the body. These infections happen frequently in immunosuppressed patients. Expect to see patients with serious lung infections caused by fungi, and also brain infections caused by these fungi. Then some pathogens can be acid tolerant, like poliovirus. Survives the acidic environment of the stomach and then can cause polio. Other species like fungus or Helicobacter pylori also can tolerate acidity, and they can infect the skin and the stomach, respectively. So you already seen part of this in the previous chapter. You saw the subdivision of the cells of the blood, like leukocytes, into granulocytes, which are the lymphocytes and the monocytes, and the granulocytes, which are basophils, eosinophils, and neutrophils. These granulocytes are phagocytes. They can eat cells. And they are having these granules that has enzymes that can destroy pathogens. Now, in the case of NK cells, natural killer cells, they are lymphocytes as well. They typically form like 5% of the lymphocytes. And these lymphocytes patrol the entire body, finding damaged cells like cancer cells, finding as well pathogens, and then they don't need to have previous activation to kill these pathogens. So that's why they're called natural killer cells. They're like snipers. And then dendritic cells, they are located in specific areas of our body, like the Langerhans cells that we have in the skin, or the microglia that we have in the brain. And they are basically grabbing antigens, presenting them to the lymphocytes so that you can connect the innate immunity to the adaptive immunity. So we have first line of defense, second line of defense, and third line of defense working together to prevent us from having infections. Also, we have proteins to defend us, like antibodies. Antibodies are produced by the B cells that are non-naive, the ones that become activated. And then we have 5 different types of antibodies. We will see what they are and how they function. And then we have a series of proteins that are called the complement system that are not activated. It's only until you activate them that they form complexes. And these complexes form pores in bacteria that are called membrane attack complex, or MAC. How does these cells communicate between each other? With chemicals that we know as cytokines. These are hormones that activates both innate and adaptive immunity. Any questions so far? So, function as a whole of the lymphatic systems, the divisions. Well, the lymphoid organs And the tissues provide residence for the immune system, which will, cells, which will be the B cells and the T cells. And then these trap pathogens, and these pathogens will be processed by these cells, and then you work together by activating macrophages to destroy these pathogens, and also activating your dendritic cells. The process of eating pathogens and other molecules is known as phagocytosis. So you here can see a bacteria macrophage extending pseudopods to trap these gram-negative bacteria. So the macrophages come from the monocytes. The monocytes are the largest leukocytes that there is, and once they exit the circulatory system, they become macrophages. These macrophages, they can be activated with chemicals, and as well, they can activate other cells. Function of the macrophages: killing pathogens that they have ingested with hydrogen peroxide or hypochlorous acid. Same for the neutrophils. They can release these molecules. Hypochlorous acid is basically an active component of bleach. When you dilute bleach in water, you're forming hypochlorous acid. And then they can secrete molecules that basically destroy these pathogens into smaller pieces, and then you can present one of these smaller pieces. And that's why these ones are called antigen presenting cells, or APC. In the next time, we will see how these antigens are presented and how do you activate the cells of the immune system.